Hi, my name is Maria Gabriela Loza Pacheco, Medical English. I'm going to about my topic is a right to distribute progesterone in women with bleeding early pregnancy. Definition: bleeding in early pregnancy loss musical cause excessive bleeding infection and the complication associated with cervical psychological heart, including anxiety, depression, and post-traumatic stress disorders. Video.
Bleeding in the first trimester is a common concern of many women, and may I reassure you that most of these are of no real problem to you. The main reason that you can bleed in the first trimester is something called breakthrough bleeding. Now, this occurs at the same time as your menstrual cycle will occur, and it compensates and carries on like little dust spotting until the hormone levels reach a certain level when it will subside. The second type of bleed is an implantation bleed, which is when the fertilized egg embeds into the side of the womb. And this just occurs one off and it's like slight spotting, but obviously of a concern to you. The third other type that's not really of anything to worry about is something called a cervical erosion. You might not even know you have this, but because the pregnancy hormones are at such a level that they cause the cervix to soften during intercourse, you might find you have this spotting. If you have any type of bleeding and you are obviously concerned, go along to your early pregnancy unit. There they can do blood tests and urine tests to check the pregnancy hormone levels. They will also do an ultrasound scan and they can check for the fetal heart. This will help to reassure you that the other more serious concerns, such as an ectopic pregnancy or a threatened miscarriage, aren't going to happen.
Application in nursing. Progesterone production by the corpus luteum on the ovary is necessary to the production of the econometric for the plantation of the embryonic. Additional progesterone is produced with an embryonic implant in the econometric and during early presensual development. Pros and cons. Pros: progesterone prevents miscarriage in the asymptomatic woman who has a history for recurrent miscarriages. Progesterone reduces the pregnancy in women who has started to develop during early pregnancy. Cons: testing with progesterone did not result in significant improvement in the incidence of the live weight among women with a vaginal bleeding of the day. Application in Ecuador. It is necessary evaluation in the pharmacology then to the implementation in Ecuador because there is no evidence to the support indication running of the progesterone in prevention is miscarriage in the first half of pregnancy. Conclusion: before prescribing progesterone, it is essential to establish the correct diagnostic and based on the tests indicate the correct term of age patterns. To use some hooks, progesterone indicate the woman with unstopped recurrent miscarriage about significantly reduces the abortion risk. Thank you very much.